Good day, good afternoon, good day for everyone. Welcome to another VUMI Health Talks. This initiative that we have from VUMI to have relevant topics to be addressed towards our agents, our teams as well. And today, it's a pleasure collaborating with the Universidad de Navarra in Spain. Well, we will be providing some indications about the session for today. As you all know, the session will be conducted in Spanish with a simultaneous translation into English, not only in English, but also in Portuguese. And you can activate this option when you consider it necessary. As you can see here in the screen, you in the sessions control that you have in the bottom part of the screen, you will click in the globe in the icon, in the interpretation icon, which is like a globe. And if you have it, don't have it activated, you also have it in Spanish language, but you can click the language that you would like to hear this translation. You can also find this in your screens. Well, then we will have a Q&A session for our speaker. You can do this through the icon of a Q&A that you will find it in the bottom part of your screen as well. In the menus, you will click in this Q&A chat box, and Dr. will be answering at the end of his presentation. Please, we ask you not to use the chat box to make the questions, but use the Q&A chat box. Well, I'm introducing myself. I'm Miguel Ecoavil. Those of you who have hearing me in this live VUMI Health Talks, I'm always presenting all of the sessions. Today, I will provide the microphone with Dr. Jose Maria Sagrador from the Clinic Universidad de Navarra in Spain. Okay, well, really grateful for his support in these VUMI Health Talks and for all of his general support. So now I will open the floor to Dr. Jose Maria Sangrador. Okay, thank you so much, Miguel, as well as all the team from VUMI. As always, it's a pleasure being with you and having the opportunity to assist to a webinar with an interesting topic about cochlear implants. Before introducing Dr. Manrique, 2-3 minutes to share with you a little bit what the clinic of Universidad de Navarra is. And well, I want to refresh you with some important data. We are a hospital located in Spain. We have two places in Navarra and in Madrid. This hospital of high complexity level, although I was saying we attend and assist all the specialties. We are really well positioned treating the international patients. We treat more than 148 nations abroad, and currently we are the best private hospital in Spain and one of the best in the world, in accordance to the Newsweek magazine. Well, if we wanted to tell three different things that specializes us, is that we are a nonprofit hospital. This means that we don't have that the patient is always is in the center, in the core of our assistance. We don't have a limit to dedicate for our patients. The physician dedicates the time the patient needs. And other of the important characteristics that makes us different is that all of our doctors work exclusively for the clinic. This means that all time they are dedicating it to its clinical work. They are teachers. We are a teaching hospital from Universidad de Navarra. jointly with the Faculty of Medicine. And also, it's a researcher institution because all of our doctors have part of their time dedicated to this research work. This also allows them to work in a very efficient way with interdisciplinary teams and to offer a high medical resolution. So for all abroad patients, it's of great importance and relevance to have diagnosis and treatment plans in 24, 44, 48 hours. So this is really important. In the case of the international patients, abroad patients, well, we work also the second opinion distance. As you all know, this is very good uptake of to assessment, more than uptake in patients. It is, and they do this through the international patients. You can establish all the treatment plan and also visas, management, treatments, and etc. Well, I am sure that you know we have leading technology for complex diseases such as a proton therapy, a robotic surgery, diagnosis platforms, therapies unit for monotherapies and different therapies. We are a university hospital. We are part of Universidad de Navarra, and we are research center. We make part of the medical research applicative medical center of this same group. And it's our combinations that make possible for the clinic to be the private hospital with great number of clinical trials that we have that are active in Spain right now. Well, what else can we add? I don't want to spend more time, so Dr. Manrique can talk. It's a complete blessing. We are really fortunate to have Dr. Manrique. He is one of the most important experts internationally to cochlear implants. He actually is the director of ENT of Universidad de Navarra. He's a specialist in hearing loss, profound sensorineural, and he's a doctor graduated from Universidad de Navarra, and he went to the House Ear Institute of Los Angeles. He's a director of a cochlear implant from 1989, and he has led different research cases of hearing implants, cochlear implant, gene therapy of hearing loss. He has led more than 150 papers in his field, internationally speaking. So with no further ado, Dr. Manrique, thank you again for being here today. Thank you for your time, for providing us with such a great world of combining technology, empathy, medicine. Well, no more, because otherwise I will be spoiling your presentation. So whenever you want, you can start, you can begin. Okay, thank you so much, Miguel, Jose Maria, for your words, for your kind words, for your introduction. If you can allow me, I'm going to share my screen. But first of all, Miguel, can you help me? Can I, yes, you can share your screen now. Well, I'm going to talk today about cochlear implant. Can you confirm me that you are seeing my screen, that you can see it? Yes, we can see it. Perfect. And now I'm ready. Okay, I'm going to talk about cochlear implants. For some of you, maybe it is something unknown, maybe you are too familiar as well with this technology, with this type of treatment. But definitely, we are going to talk about a treatment that's addressing different types of hearing loss and that at some time can change their lives through this treatment. This is one of the treatments that have done a breakthrough in the hearing loss in these last 30 years with a great progression with around everything, technology that's being used, the indications that are being done, the outcomes, technologies that it used. So we are facing one of the most important breakthroughs in medicine, and of course in ENT, in the some progress that greatly has been done with the ear. So now let's move. I cannot move my presentation. I'm having some issues to move forward with my presentation. Well, sometimes we have difficulties with technology as we are seeing it now. But well, in this case, I have my screen freezed. I cannot move my presentation, unfortunately. Okay, now. Okay, yes. Well, as an introduction, we are talking about a program that has different aspects. Most of the experience, we are concentrating it in the programs within the cochlear implants. This has been an experience of more than 1,400 patients, but also we have experience in other hearing implants as a bone, uh, middle ear, brainstem implants in combination, sometimes with the use of hearing aids. We are a university center and we've always worked a lot into associating everything that has to do with research to our activity, assisting activity. Currently, we have three scopes that are really important that we work in terms of investigation. The diagnosis of the hearing loss, having a personalized medicine to be applied to all treatments for people that have a reduction of their hearing. And also, we have worked especially in the experimental scope with everything that has to do with that inner ear, especially how can we address and approach these small organs in a minimally traumatic way that can allow us not harming, and we can preserve all its function even when we place a cochlear implant inside this inner ear. Well, about this topic, we have published more than 150 papers, 11 monographies, 59 chapters in textbooks, 8 textbooks, multiple conferences through the world, around the world, and we have worked in more or less 80 research projects about this topic. So yes, these numbers reflect the activity that we perform around research in this scope. Well, what is a cochlear implant? We are going to try to explain you what are we talking about. First of all, I want to contextualize. A cochlear implant with other hearing aids. There are different ways of stimulating this pathway. Some of you is the acoustic way through hearing aids, but there are also devices that can be implanted, such as the bone conduction and also the active implants of the middle ear that use vibration to be applied to the cranial surface. And in this way, we can take this stimuli to the inner ear. It has its own indications of a conductive way, but in this case, we are going to focus ourselves especially in cochlear implants, which are devices that, as you will see, can totally substitute the external inner and middle ear to generate an electric signal that goes directly to the auditory nerve. And we are going to do this through this device, this equipment. You can see a graph, a scheme in the right side of the screen where you can observe that there's a component, an external component that we call an external processor that has a microphone, has some batteries, has a processor, and gathers and collects information and sends it through a coil through an internal component that we call cochlear implant that gathers and collects this signal through the skin, and it processes again a stimulator that sends a signal to the different electrodes that are located inside the cochlea, close to the auditory nerve. So this therefore generates an electrical signal that passes through the neurons and moves until it will be interpreted in the auditory pathway, especially in the auditory cortex. You can see in the left image these components. Here we have what's been placed in a surgical operation. Here we see a magnet, we have a stimulator, and then we have some wires, one of them that contains some electrodes that will be located and placed in the cochlea. And externally, you can see a coil. And at the same time, in this part, we have a battery with a processor and some microphones. This also have some other formats, and this can be summarized in a auditory processor. External, it's rounded with any type of issues. Well, the questions that's always asked by a patient, and we still receive these type of questions when they come to our office. What can you hear with a cochlear implant? My answer is that it's very similar to what we hear in normal conditions. Well, no, it's not a Morse code. These are not signals that cannot be interpreted as we could use with any Morse code. And at the beginning, as usually happens for those who listen to the auditory pathway, yes, we understand, not in a perfect way, but during a period of time, it becomes in a perception that it's natural. And the proof of this is that children that have never heard and that start to develop language thanks to the signal that is received to the implant, produce a language that is very similar for those children that normally hear, and that do it totally comprehensible for any person. So this is a demonstration that what they are hearing is very similar to what they are expressing. There are ways that are more sophisticated, technologically speaking, to prove what is that goes out through a cochlear implant. And we can see here these induced spectrograms that reproduce the word choice. In the left part, we decompose the sounds that we say when we say this word choice, and we do the same things with the cochlear implant, and we see that the pattern in the spectrographic that comes with the cochlear implant is very similar, is very similar to what we obtain with our voice. Well, the placement of cochlear implants must be done under a context that we have a program of cochlear implants. This program needs a structure. We need the collaboration of different professionals that collaborate to perform a selection of each candidate, of each patient that will be collaborating in the procedure, in the surgical procedure, that will be collaborating in the activation and scheduling of the implant, and in the follow-up of the patients that are going to be treated with cochlear implants. So it is important, this cohesion of the different professionals that are working in an cochlear implant program. And fortunately, in our center, we have a very good work that is being done with all of our professionals that work for the program to have a good quality that ensures, as you can see in this left part of the image, an adequate outcomes. The outcomes of cochlear implants depend on different features of patients, depends on the technology that we are using, but also depends on the quality, the work that is being done by all the professionals that are involved in this cochlear implant program. On the other hand, also in our center, we've always used, and we still use, the state-of-the-art technology that we have in the market for a cochlear implant. Always through this more than 30 years of existence in our program, we've always uh, tried to provide to the patients the best technology possible that exists currently. Not only we address what we just said, but also we ensure that after placing a cochlear implant, the patient will receive an adequate assistance. It doesn't start and ends with a surgical procedure, but there's a continuity of the treatment. And for this, we use work models, online working models through telemedicine. Well, this is really useful because it allows us to connect with our patients being far in Colombia, in Peru, or elsewhere around the world. So fortunately, as we are doing it today through this Zoom webinar, we can do that same work, and even we can go and we can enter to the implant of each patient to study, to assess and analyze. We can introduce new calibrations and new upgrades that can allow optimization of those outcomes. So this is absolutely possible today. Who needs and what are the indications for the cochlear implant? Today, there are different indications. There has been a shift, an important shift and change through these 30 years about the indications in such a way that at the beginning, 30 years ago, we only placed those implants in people that didn't hear anything at all. And therefore we placed an implant. This is what we call unilateral cochlear implant. Later on, we tried to rehabilitate those cases of profound hearing loss in both ears, using cochlear implants bilaterally. The audition in any person and hearing in any person, it's important to be nourished with this bilateral information that comes through the ears under normal conditions of these hearing aids, but also through two cochlear implants. This reports better hearing levels for the patients, and especially better hearing levels in those noise environments. We don't always have a profound hearing loss, but also they can be given some asymmetry situations in such a way we can have a profound hearing loss of one ear, and in the other ear some type of audition and hearing. So in this case, we can combine a cochlear implant with a profound hearing loss, and in the other ear, we can combine it by using a hearing aid, and we call this bimodal stimulation. This is a very frequent indication in adults with a very good compatibility about the hearing aid and the implant with good outcomes. But even more, we can say that even in some cases that we have a profound hearing loss in one ear and in the other, there's a natural hearing, we can also use a cochlear implant to treat the bad ear, but the other ear we can use the natural hearing. Um, this has totally has been a breakthrough because it restores the bilateral hearing, what we were saying before, which is really important for all of the patients. But even more, we have advanced so much given the fact that we have incorporated better implants, but also incorporating techniques that are not traumatic for placing cochlear implants in people that have some hearing but don't have satisfactory results with their hearing aids, but also we can somehow restore the comprehension of these people using a cochlear implant combined with a hearing aid in that same ear. So all of these situations can be treated in the clinic in our cochlear implant program, but we still have one more indication. There are people that, due to different reasons, have severe in, this frequent people that have lost hearing all of a sudden in 1 year, that have severe change their lives, and we can validate in a very well way and efficiently placing a cochlear implant. So in the equation, as I was saying before, we are restoring function, but also treating tinnitus when they have a severe component, which is really that has a disability for people. And through the experience that we have acquired through this year, not only we are trained to use cochlear implants when the anatomy is normal, but also when we have difficulties, anatomical difficulties, as in a cochlear ossification after a meningitis, when there's a malformation of inner ear of a genetic origin, when we are familiar with treatment of those cases of syndromes with other disabling situations that can allow us to treat it very personalized, most of all in the follow-up treatment. And we also are a center with a lot of experience for other centers, refer hospitals that can be around the field of cochlear implants. And even some cases, we can perform these surgeries under local anesthesia. This is especially interesting in older people. What are the results? What are the outcomes of our program? Well, the first message is that the cochlear implants do work. So it seems like it's like a presumption that saying we are assuming that they work, but through these years, clearly we have seen many data that are based on evidence in which that cochlear implant is an efficient treatment for the hearing loss. The results are going to vary as a result of many factors, but within them, we have age of implantation. The best results of cochlear implants, we have them in children, and children treated before their first year of life. These children are able to understand 100% what they hear. They are able to develop a very good bilingual speech and language. They are kids that are going to evolve at school, university, the maximum programming development. Well, with adults, those adults post-occupative medium between 60-80%, and also the older people above 60 years, this number is reduced around 60-70%. But all of them, it's important, are sustained through time. So that are not only for through 3 years of implantation, but these are patients that will keep these results for their lives. There's no age to place a cochlear implant. We are talking about 5 months old, but also people with 100 years. Well, in this case, in older people, they can be adequate to the cochlear implant and they have a good environment, but the age per se is not a contraindication to place a cochlear implant. And this is especially important to consider that the hearing is essential for the cognitive development, not only for children, but also for the maintenance of this cognitive development. So it is tremendously important to consider that the stimulation, that hearing stimulation is like a caramel, it's like a sweet for our brain, and that is able to prevent in a great measure some of the cognitive disablings that are exists in older people. With respect to advancements, the surgery is minimally traumatic, and this makes it possible for our surgical procedures to have a low complications rate under 1%. And most of the cases, we can preserve the microstructure of the cochlea, and therefore we are able to allow our patients to benefit of future treatments that can exist. Also, we need to highlight about the bilateral stimulation of the auditory system with implants or natural hearing implant, also with the use of a hearing aid and an implant. Because why? This allows to hear better, to locate sounds, preventing what we call the shade effect of the house. Because when you don't hear by that defect of the ear, because we will be discriminating better in noise environments, and also, well, this post-lingual, we can capture the best ear. Well, and this is especially important to keep the development and the maturation of the auditory system. It is important that we receive sounds through our ears, but also we process it in our brain, in the cortical auditory areas. And basically, this bilateral stimulations ensures that maintenance and development of these cortical auditory areas will be preserved. Okay, in children, we can measure what are the outcomes, and with respect to adults, how they are able to understand a conversation, but also we are able to explore these outcomes that are obtained through their scholar development. And look how we have moved with the previous era to develop with poor curriculary. So actually, the linguistic skill is the same that the normal people hear. And this allows to address and to assume school opportunities, not only for elementary or high school, but also to universities. So they can have access. And this definitely makes it possible the oral bilingualism and to have access to other languages, which is so important today in a globalized world. We can also measure outcomes within cochlear implants in the labor scope. In adults that we are treating with a cochlear implant, what can we measure and what have it benefited in their labor and work performance? And here in every day we can assess a working survey, a work survey based on a questionnaire, and one of them is this number 15. Have you improved your work with the cochlear implant? Believe it or not, yes, it has improved. There's a positive response in such a way. 88% of cases say that yes, indeed, they had lived positively their influence of a cochlear implant in their work performance. Well, we must not forget that the outcomes of a cochlear implant, as I was saying, depends on the different situations of the patient's biological, also the technology that we are using, and also depends on the quality work. There's no doubt that today we are talking about personalized medicine, and this makes it possible that in a program for cochlear implants that we can personalize, we can tailor each professional's working through the different characteristics of the patient in order to provide the best way possible, the best outcomes. Well, as conclusions, I would like to highlight that the cochlear implant is an efficient technique and safe technique for treatment of hearing loss at any age. Our cochlear implant program of the clinic in Universidad de Navarra makes it possible that correct election of a candidate, the efficient execution of surgery and programming, and adequate and enough rehabilitation, that tight coordination between specialists that engage and are integrating the program, and the appropriate follow-up of the patient that has received an implant, and the maintenance of that implant system. Again, I want to thank your presence today, your invitation for me to make it possible for being here. And of course, I will be delighted to answer to any question that you may have today about this beautiful system, cochlear implant system. Thank you, Dr. Manrique. It has been really interesting, your presentation, that you can do your question through the Q&A chat box that we have in the bottom part of the screen. In the meantime, we have some questions for you. And I think you have mentioned it during your presentation, but maybe we could clarify something. How is that process, the recovery process? How long after having the implant the person will feel a change, a real change of passing and moving from not hearing anything to hear something and start feeling that they do have some comprehension of words and they can start having this connection with language? Well, let's separate two groups. Let's talk about this. First of all, the post-lingual patients, people that have heard, that have developed language, and at some time with the disease, they will be losing their hearing. They have a hearing loss. Any of us that are here today, unfortunately, all of a sudden, we have an accident or a disease, illness, we lose our hearing, and we receive a cochlear implant, okay? Detection of sounds starts immediately after activation. That same time when we program and we activate the implant, the patient starts having a perception, a sound perception. It depends on the etiology, the origin that caused that hearing loss. Sometimes that first week they are able to follow a conversation with any other support. So reestablishment of a communication skill will be produced in a short period of time. There are other people that, due to the idiosyncrasy of the disease, they can deteriorate not only the inner ear, but also the auditory nerve. We will have a period of a prolonged progression, but normally, in a very immediate way, this post-lingual, we will have a positive perception of hearing around the first weeks. And generally, the progression will be improving through that first year. From here, we establish a plateau. And from children is different because we are talking about new birth that don't have a hearing loss, a permanent hearing loss, and from the beginning in those first months or first years of age. So it is important, this early stimulation of children that are born with a hearing loss. It has to be done as much as possible because the outcomes will be better. So what happens with a kid where we implanted really early an implant will have the same evolution as a hearing child. As you know, when we have a newborn, they can be standing and they can hear some sounds, but they cannot understand what their parents are saying. So these are two aspects. Also with weakness at the same time in which we activate that implant and they are able to detect sounds, but the moment they need to understand a word or to say it, they will follow a process in time very similar to a hearing kid. It means that this time of language development, perceptive and expressive under normal conditions, addresses those first years of life. And of course, we will be seeing, especially between the second in third year of age, there's like an explosion about that development and that language expression. I would like to close here a topic. How's that care? Most of all in children. They have and they need a special care for the ear. Telling the kid, be careful, a particular care about that implant, if that to hit the head or something. Yes, an interesting question. I'm going to start by saying that kids, they are aware, children are aware about the value of their cochlear implant and they really take good care of it. Yes, we have some issues with syndrome, children with other disabilities, but under normal conditions, most of the kids are going to be careful with those implants, as we say in Spain, like gold. They will be really careful with that implant. They will really take care. And then what care under normal conditions? There are no big restrictions. There are few restrictions that they have for their sports activities, water activities. They can do a normal life. Yes, the processor, the external processor, when they take a shower, they need to remove it. They need to protect it with silicone capsules or well, but normally they can do a normal life. They can perform a normal life. The implants can stand great impacts. There could be a trauma on that area, but it has to be a big, big trauma. So generally, to break a cochlear implant, we are in front of a trauma that can generate a fracture in the brain, in the skull. So sometimes the implant stands better a trauma than a skull or the brain. I can say this. Yes, always we need to take care of things, no doubt, but they admit a really good tolerance that it's wide, a broad tolerance. Well, I apologize with the audience. Let's start with the questions. What is the answer of patients with severe and profound bilateral hearing loss? How do they feel after this surgery? This group of patients are extremely interesting for us because somehow we are comparing, this is a comparison model of a normal ear with normal hearing with another ear that's going to receive an implant. What can you hear with the implant with respect to the normal ear? So this is a very interesting model. There's a 20% of patients, of these patients, that when you activate, they can hear really well and really they integrate to this natural hearing and with the cochlear implant from those first days of surgery. What's normal? 80% of the other 80% of people that they need to do auditory therapy during the first year. It is very important in this group of patients. The pre-implantation guidance in order to show them and demonstrate them that it is necessary that after the placement of the cochlear implant, they will give time to the brain in order to integrate, engage that information that comes from the natural ear with the ear that received an implant. And this fusion, this linking process, they can do this. They will need this period of time for 1 year. In this group of patients, sometimes we produce this indication that you place an implant for the treatment of those people that have tinnitus, severe tinnitus. They are just to become to become suicide people, and that cochlear implant reduces a 0 scale and 10, and they have a score of 9 to 10 tinnitus, they will reduce it to 2, the intensity of the tinnitus. They make extremely tolerant. There are some patients that they implant in these cases for this reason, for the tinnitus situation. Really interesting, yes. Now I'm going to make a question, a specific question, but it's also interesting for people that we are above 30 or 50 years old, because I would understand that technology has changed a lot, as you have mentioned it before. We have a patient, a woman, 33 years old, that is already has received an implant when she was 12 years ago, because many times ago, an implant, if the implant failed, they would test with the other ear. In the ear that this patient does not hear anything could be a candidate for using a cochlear implant for after having received an implant for 30 years? Yes, interesting question, because it talks about the hearing loss affecting the future results. Yes, yes, it influences it. I mean, that I said it before with children, the early stimulation of that second and first ear, also adults, a person like us, if we lost our hearing and we are implanted at 45 or 85, this will influence the results that we will have. In this particular case that you're talking about, there's a phenomenon that we call dominance. If there has spent a lot of years without being stimulated, and this is a person that somehow depends on the mono hearing that has been done by the cochlear implant, it's possible that after 30 years, the results in this second ear will not be so good. It does not occur in all of the cases. We have been able to identify a 15% of patients with this pattern, exact pattern that you are talking about, that they can have a great benefit with the cochlear implant. We can predict it. We can somehow know beforehand deciding to place a cochlear implant. Yes, in our center, we have developed for a long time ago, we have an algorithm, a working algorithm with PET, the hearing PET. That same technology that is being used in cancer, in neurology, etc. We are using it to know the condition of the hearing cortex and in other associated areas of the cortex. And we can define the activation of that hearing cortex in such a way that we can predict beforehand, before doing the implantation, if the result will be good or bad. So for this particular patient, I would recommend to do a study, to perform a study, because we could say to the patient if the placement of the implant will help or not. But I take the time to tell you that it is really important, the bilateral stimulation of the auditory system as soon as possible. This is relevant. A short question, because we have many more. The system uses a battery that needs to be recharged? Yes. Normally, we have been moving and shifting from batteries that we needed to change every day. Now, all batteries, most of the new equipment are rechargeable. And normally, the autonomy of the batteries in the new implants, I'm talking about new implants because this is what we would place from now on, is 16 hours of use under maximum conditions. So yes, overnight it will be recharged, and in the next day it's available for its use. Thank you, doctor. Unilateral hearing. That unilateral hearing loss. This person uses a hearing aid. Can it develop a normal life, or it is better to do and place a cochlear implant? Depends on the hearing loss. Depends. If there's a criteria of a severe and profound hearing loss above 85 decibels, or discrimination levels less than 50%, using a hearing aid, yes, it can be a candidate for cochlear implant, because under these circumstances, the patient will hear better with an implant than with a hearing aid. Yes, the audiometric assessment will help to take that decision. if that person will continue with the hearing aid or otherwise to place a cochlear implant. Here we have a question associated to a condition. Is it feasible for cases of neurofibromatosis when there's a partial hearing loss? There's a comorbidity. Yes, this is a very interesting question as well. And it has two ways of to answer. When you have a neurofibromatosis, it develops a tumor in the auditory nerve. Sometimes in these surgeries, we can remove that tumor, preserving the cochlear nerve. And in this type of patients, we are able to proceed in that same surgery, the placement of a cochlear implant. But sometimes the neurinoma or the tumor formation destroys the cochlear nerve in a complete way. And there's another device that's called auditory device of the brainstem when we also have experience that proceeds to stimulate the auditory pathway through the cochlear roots in the brainstem. This surgery can be done simultaneously with removing the neurinoma of that side. And we have experience. There are different cases because neurofibromatosis varies in its presentation. But we also have patients only with one cochlear implant in one ear with neurofibromatosis, and we have in the other ear brainstem implant. So again, sometimes we use different technologies with the aim of reestablishing this bilateral stimulation of the auditory system. You mentioned this, but maybe we can clarify to our attendees. An adult patient, not an old patient, but an aging patient with a bilateral hearing loss with sounds, but does not distinguish sounds. This could be a candidate for cochlear implants. Yes, indeed. Yes, this is a very normal pattern. Patients that hear but don't understand what they are hearing, and they have a poor results with the use of hearing aids. And yes, they can be rescued with the use of cochlear implants. Of course, each patient has to be assessed differently in a personalized way. But yes, I would tell them that yes, it deserves to be studied. There's a question about a possibility for infections. Can you expand this? What possibilities about infections we have? Well, this is in our center, the rate of complications that we can say severe is less than 1%. Under these complications, we have a failure of the system. There can be technological failures, any device. Well, this supposes with the new implants, like around 0.02% of complications. But yes, we can have a contamination of that implanted material. This can occur with a cochlear implant. It can happen with a pacemaker. It can happen with a catheter or a prosthesis, a mammary prosthesis. Every time we introduce an artificial device, it can be contaminated and it can force to remove that implant for a period of time and then to substitute it with another one. What percentage? Of course, it's not 0.03%. It's really rare and not so frequent, but yes, it can occur. This is a complication that can occur. This is a technical question. The transmitter and the receptor, the stimulator has to be placed in the bone like an antenna or a transmitter? This is a technical question. Okay, the internal components have basically two parts. The antenna and the stimulator are under the skin over the cranial bone. Okay, they are not inside of the skull, they are over the skull, just beneath the skin. The electrodes, what are going to stimulate that auditory nerve, yes, they need to be drilled a part of the ear, which is the mastoids, to have access to the inner ear. to a window that communicates the inner ear with the middle ear, that it's called the round window. But as I'm saying, most of the implant component is over the skull. Then externally, we have all this complex of microphones, batteries, hearing processor, coils, and transmission. This is a question because at the end, this is something individual about costs of procedures, etc. But maybe not only about the costs, but also, but talking to the most, this topic, how long, what is the time that passes between when you take the patient, when you receive the patient? I understand that this is individually, but most of all, what's an estimate when there's an international patient and when you see this as an outpatient patient, but there is, you're going to be reviewing and seeing this patient permanently. But yes, I'm going to respond this last question and also to the previous one related to costs. With respect to this last question that you asked, in an international patient, what we normally do, first of all, we receive information, basic information. Someone has seen the patient, an ENT in the country. We ask for that information, medical report, and then this is useful to make a selection if you're a candidate for an implant or not. From here, we make an appointment with the patient in such a way that all the explorations that we need to do, even with children or babies, we will do it in 2 days. In 2 days, we are able to establish a diagnosis and we can do an indication, a treatment indication. And normally we have that surgery appointed for the cochlear implant. In 1 week, we are able to cover diagnose, surgery, post-op, and to be ready to have this outpatient. And then we need to be aware about the fact that the person that has a cochlear implant needs a life follow-up because, and therefore this implies a follow-up, a constant follow-up. This follow-up, as I was saying at the beginning, can be done online. So we can connect with the patient uh, elsewhere and we can analyze how the implant is working. We can schedule the implant. We can program that implant. Okay, normally it's good that first programming or scheduling appointment to be in person. Normally that first activation can be done 2 weeks after surgery. So how long does a patient, an international patient, to be from day one diagnosis to the activation? Less than 3 weeks. And the follow-up can be done distance. With respect to costs, there are many studies today. Well, I'm not going to respond directly, but yes, indirectly I can respond you with respect to benefit and cost of the procedure. This is highly profitable. Many times the hearing loss is an invisible. Society doesn't quite know the level of frustration that a patient has or the impact for its development. So if we analyze the cost of an implant with respect to the benefit that will provide to that patient, well, reduction of that disability, accessing the labor work, scholar work afterwards, well, this has a really incredible positive relation. Yes, that's right. Even in older people, I mean, yes, even in older people, because many times the older patient and the aging patient, well, there's no problem. Hearing loss is even a natural process of life. And this is unfair somehow because it limits you to make other activities. Yes, absolutely. Well, before Jose Maria ends this webinar, well, I want to thank you. This has been a very interesting presentation that we can talk previously before we started on live, but yes, it has to do with technology, but also with the social part and also with a human being to be able. What's most important is communication, fundamentally, one of the most important things, and it improving this capacity from being a baby, it changes lives. And also for an aging adult, an older adult that can change their lives at some period of time. So I want to thank you for all your knowledge and this comprehensive knowledge that you shared with us. First of all, the Clinic Universidad de Navarra and all the participants for today. Now, Jose Maria, for you to close this webinar. I'm delighted for being here again. Really grateful for the possibility for being here. Well, I want to reiterate my gratefulness for the VUMI team to talk about this interesting topic that changes the people's lives, as Dr. Manrique says, the way they behave, everything. And well, it's a pleasure. We are here for you, anything you need. And those for you who have been here connected through VUMI or, well, the best way possible, we are delighted to support all of the patients in everything they need. Okay, thank you so much. And we invite you all to the VUMI Health Talks that we will be starting again in August. And I want to invite you to visit our blog in VUMI. So thank you, Jose Maria. Thank you, Dr. Manrique, and we'll see each other soon. Goodbye. Goodbye. See you soon.